Let's continue on the theme of healthcare here, and I want to ask you what the most important lesson you learned was as it relates to healthcare during the pandemic, which would improve things going forward now that you have that knowledge. We have brief opening statements and then four-way debate. Mr. Ford, you get the first kick at this.
Well, I'm going to answer your question straight up. That was the most challenging time of my entire life as Premier, and I don't wish that on any Premier or any administration in the future, as we inherited an absolute broken system in long-term care from multiple governments. It was a challenge. Did we get everything right? No, we didn't get everything right. But I'll tell you, every decision I made was with the best intention, with the best medical advice I could get at the time. But we're going to fix the system. We're fixing it right now until no other Premier, no other administration has to go through what we had to go through. You know, there were challenging times, but I'll tell you, I'll make sure that never happens again, ever.
Thanks, Mr. Ford. Mr. Schreiner.
We need to make sure that we're adequately prepared for the next crisis, whether that crisis is a pandemic, whether it's the climate emergency, whether it's some unknown crisis that's bearing down on us. And that means investing in people, making sure our care providers are adequately and fairly compensated. It's making sure that the most vulnerable are protected. You know, one of the reasons so many doctors say that we should be writing prescriptions for people, for them to access housing or food, is because the most vulnerable who don't have access to housing or food actually put the most pressure on our healthcare system and bore a disproportionate burden during the pandemic. We need to invest in them.
Thanks, Mr. Schreiner. Mr. Del Duca, you're up.
I think the most important lesson that every leader should have learned during COVID, in particular in healthcare, is that you have to follow the science. You do have to listen to the medical evidence, especially when you're dealing with a public health crisis. Now, everybody watching at home knows that in February 2021, when the science table told the Ford Conservatives don't reopen so rapidly and they ignored it, that made subsequent waves of COVID dramatically worse for Ontario families. And then when he scrambled, he decided he wanted to close playgrounds and give police more powers for carding that bore no relation whatsoever to the challenge that we faced. Yes, we need to get to the bottom of why this province wasn't prepared for sure, but the way to go forward in a responsible and thoughtful way when you're dealing with healthcare crises is to listen to the science and follow it in a thoughtful way.
Andrea Horvath, your time.
Thanks. Whenever I think about what happened during the pandemic, I think about long-term care and the absolute tragedies that took place there. I think about people like Kathy Parks, who was traumatized by the death of her father in a private long-term care home, a for-profit long-term care home, who basically refused to give him the care that he needed. Lots of families watched as loved ones, as the armed forces showed us when they arrived, dying in long-term care homes of malnutrition and dehydration. Our seniors should have never gone through that, nor should our government have had put a law forward so they couldn't sue and get justice to protect their buddies in private long-term care.
Thanks, Ms.
A lot
Horvath.
more to say about this.
Okay, we have 5 minutes now of open debate. Mike Schreiner, you get the first kick at it.
I talk about the fact that we need new solutions to old problems when it comes to our healthcare system. We need to invest in people, investing in the people who provide care, but also investing in the people who need that care. The biggest driver of stress on our healthcare system is actually poverty. It costs our province $33 billion a year. There are literally doctors and nurses saying we should be writing prescriptions to address poverty if we want to take pressure off of our healthcare system. Let's talk about housing. University Health Network says we should be writing prescriptions for housing because one of the biggest drivers of people going to hospital is they don't have safe or affordable housing. So let's talk about ways that we can prevent illness and promote health by investing in
Let's do that.
Yeah, sure.
1, 2, 3. Go ahead.
So as I was saying earlier, look, when you go through the kind of public health crisis that we have, in addition to listening to the science, you need to know that, as has been mentioned earlier, mixing the private sector and care, in particular elder care, is wrong. But we also see that with Doug Ford and his team and how they want to clear the surgical backlog. Our Ontario Liberal plan will invest $1 billion over 2 years to clear that backlog. We're going to bring on 100,000 new healthcare workers. We're going to repeal Bill 124 so nurses and personal support workers get the support and the compensation that they deserve to have. We'll continue to invest in physical buildings, including expanding community health centers, building 15 new CHCs right across the province of Ontario.
Ms. Horvath,
but
you
it really
okay with
does
all
boil
that?
down to public
You okay
versus
with all
private.
that, with this checklist?
Doug Ford, who
here's,
prioritizes private all the
here's what
time.
I think that we should be thinking about when it comes to our healthcare system. We saw what happened with COVID-19. We should have learned a long time ago that you can't squeeze hospitals. You can't fire 1,600 nurses like the Liberals had done. If I was in charge during the COVID-19 pandemic, I would have made sure people had paid sick days to prevent the virus from spreading. I would have taken care of the kids in schools, made the classrooms smaller to avoid the spread of back into community. I would have made sure that an iron ring was put around seniors in long-term care. How shameful that there was no protection for seniors in long-term care. And instead, this government protected their buddies by preventing them from being sued.
Let me get Mr. Ford to comment on that. Hang on, we should let him, you've made an allegation, we should let him respond to that. Mr. Ford.
I'll tell you, one of the biggest challenges when it first started was the PPE. Mr. Del Duca, you left the cupboards empty. I'll never forget it. Them calling me up and saying we have 5 days of PPE because the Liberals didn't restock it. And right away, I gave a shout out to industries, and within 2 days, 26,000 companies came online on our portal. And now we'll never rely on any other jurisdiction, any other country in the world for PPE. 3M is manufacturing millions and millions of N95 masks. We have surgical masks, we have gowns, we have face shields.
Okay.
We have everything that will never have to be in that position
Quick comment here. Hang on.
And Medline.
Stephen Del Duca first. Stephen Del Duca.
There was a criticism there. Look, there's no doubt in my mind the people of Ontario have an exceptional capacity to rise to the occasion of a challenge. But I want to understand better. I think people at home do as well. Why, when the science table told you in February 2021 to not reopen so rapidly, why did you choose to do so? And then why did you tell little kids like my own daughters that they couldn't go to playgrounds and that police should have more power to trample on charter rights indiscriminately? Why was that your solution in the midst of that moment of crisis? Why? Why then? Why
Mr.
then?
Del Duca, as I said earlier on, folks, was everything perfect? No, it wasn't perfect. But if there was an issue, I'll get up there. I made the change. I apologize. But
Playgrounds and
let's
police.
just talk about that
Playgrounds
for a minute,
and police.
Mr. Del Duca. For 2.5 years, literally 24/7, I was working on this pandemic. It's easy to sit back from the sidelines when you didn't have to make the tough decisions that I had to make and criticize. You have the easiest job if you just sit there and criticize.
Mr. Ford, respectfully, Mr. Ford, respectfully, this is the job that you signed up for 4 years ago. You asked for people to support you 4 years ago. You ran to be premier. You must accept responsibility.
Very good. You've both made your points.
You've
both made your points.
At the core of the
Can I please have we need the last 25 seconds. Mr. Del Duca,
Oh my goodness.
Mr. Del Duca, please. Can I please? Excuse me. Can we please save 20 seconds for Andrea Horvath to respond?
So I did want to say that one of the things we have to acknowledge is that there's still a lot of people suffering from COVID in terms of mental health challenges, people that lost their businesses. Mr. Ford got the calls from Walmart and they did well, but small businesses lost a lot. People lost loved ones. We have to take care of folks' mental health in this province, and then we have a plan to do exactly that.
That's healthcare?
With mental health through your OHIP card, not
That's
your credit
healthcare.
card.
Now